Hi, my name is Rachael Lappin, and today I'm going to be demonstrating the insertion of an in and out catheter for a sterile urine specimen collection. So before I start, I'm going to go ahead and wash my hands, and I will read my healthcare provider order. So my patient today is Ren Harumi, date of birth is 3/3/83. She had a double lumen catheter that was anchored in place, and it was discontinued 2 days ago. She recently spiked a fever of 101.5. I have called the physician and obtained an order for a straight catheter to be placed now to collect a sterile urine specimen for culture and sensitivity test. So that is the procedure that I will be performing today. So I've already collected all of my materials that I'll need. So here I have my sterile gloves. The packaging is intact and unopened, and the expiration date is in 2022, so it's unexpired and is safe to use. I also have my catheter kit here. This is a 14 French 4.7 millimeter straight in and out catheter kit. The packaging is intact and unopened, and the expiration date is in 2021, so it's unexpired and is safe to use. Here I have my basin with washcloths that I'll use for pericare, and I would have also obtained some foaming soap that I can use for cleaning. I have multiple pairs of clean gloves here that I will use for multiple skills throughout this demonstration, including for pericare and for assessment of the bladder. I have my hand sanitizer that I'll be using for hand hygiene, and I have my healthcare provider order that's telling me what I need to be, what skill I need to be performing, and it also has the patient's information to double check their identity. So I'm going to go ahead and enter the patient's room. She says, "Come in." "Hi, my name is Rachel. How are you doing today?" She says that she's doing okay. I'm going to wash my hands on the way in. "All right, would you mind telling me your name and date of birth?" She says her name is Ren Harumi, date of birth is 3/3/83. And while she's saying this, I am simultaneously checking that with my healthcare provider order, and that indeed matches and says that her name is Ren Harumi, date of birth is 3/3/83. And to just double check that this is correct, I am going to compare this order with the patient's wristband, and the wristband states that the patient's name is Ren Harumi, date of birth is 3/3/83. So just checking this one more time against the healthcare provider order, Ren Harumi, date of birth 3/3/83. The wristband and the order match, so this is the correct patient. But to verify one more time and one other way, I'm going to check the patient's ID number. So according to the wristband, this patient's ID number is 160011180, and according to the healthcare provider's order, this patient's ID number is 160011180. So I'm just going to double check that. 160011180. All right, so the wristband and the healthcare provider order match for that as well. So this is indeed the correct patient. And this is going to be my designated side table at this time. All right, Ms. Harumi, I have a few more questions for you. Can you tell me where you are right now? She says she's in Northern Kentucky. Perfect. And can you tell me what day of the week it is? She says today's Saturday. All right, awesome. And then can you tell me, do you know if you have any allergies? She says no. Okay, do you know if you're allergic to betadine or latex? She says no. So that means that all of our materials will be safe to use as she's not allergic to any of them. And according to our questions, we can say that she is alert and oriented ×3. All right, so now I'm going to just tell the patient what we're going to be doing today. So Ms. Harumi, today I've been asked by the doctor to collect a sterile urine specimen from you. And in order to do that, I need to insert a catheter just for a few minutes to drain your bladder and collect the specimen to send to the lab. Is that okay with you? She says yes. So I now have permission from the patient to go ahead and perform this procedure, so I can get started with the next step. All right, so I'm going to perform hand hygiene, and I'm going to go ahead and assess the patient's bladder on her abdomen, just to make sure that there is indeed enough urine in the bladder at this time to collect this specimen. So I'm just going to grab my clean gloves. And I'm going to pull the sheet down just enough to expose the abdomen, but still providing enough privacy for this patient. Also, before doing this and before putting the gloves on, I should have raised the bed rails, raised the bed to the proper height, and lowered the bed rail on this side. So now I'm going to just palpate the abdomen. Are you having any pain or discomfort or tenderness? And she says no. I'm not feeling any distension at this time, so I'm going to go ahead and percuss to see if the bladder is full. Okay, I'm hearing some dullness, so that would tell me that there is indeed urine in the bladder, which is a good thing because we need to make sure that we have enough to collect and send to the lab. And then if I wanted to verify how much is actually in the bladder, I can take a bladder scanner, works kind of like an ultrasound, and get a measurement of how many milliliters of urine are in the bladder. All right, now I'm going to go ahead and re-provide privacy. I'm going to go ahead and discard these gloves. And then I can go ahead and assess the need for pericare. So upon inspection, it appears that pericare would be indicated for this patient. So I'm going to go ahead and grab my materials and get prepared for that. So provide privacy. I would make sure that the patient is safe by putting the bed rails in a proper position while I'm collecting my materials. So I would fill this basin with warm water. I have my washcloths. I would grab my, my foaming soap. I would also perform hand hygiene, and I will put on a pair of clean gloves at this time. I'm only going to expose as much of the patient as necessary, and I will help her into a comfortable position. And I'm going to go ahead and start with pericare. So I'm going to get my first washcloth, get it nice and wet in the warm water, and I'll take my soap and spray a little bit on the washcloth, spread the labia clean down the far side. Now I'm going to get a clean part of the washcloth, spray some more soap, spread and clean down the near side, and then I'm going to flip the washcloth the other direction, and I will spread and clean straight down the middle. And now this washcloth is done, so I can just stick it to the side for now. Now I'm going to get a second washcloth. This one's clean. Going to rinse it in the warm water, spread the labia, clean down the far side. Or rinse down the far side, sorry. And then I'm going to flip it the other way, get a clean spot on the washcloth, spread, rinse down the near side, and again, switch locations, flipping the washcloth inside out, spread and clean, or rinse straight down the middle. And I'm going to go ahead and put this off to the side because we're finished with that. And then I'm going to take my third washcloth and go ahead and pat the area dry. We want to make sure that it's completely dry before starting the next part of our procedure. So I'm going to go ahead and put these in my basin and move this to a secure location where it's still within reach, but I'll clean up the materials at the end of the procedure. I'm just going to stick that there. I'll go ahead and discard these gloves and perform hand hygiene one more time. Then I can go ahead and set up my sterile field. And before setting this up, to make sure that I do not contaminate anything, I'm going to go ahead and remove my ID badge, just because I don't want that to get in my way later. So I'll put that out of the way. I'll go ahead and grab my catheter kit. I'm going to be using the packaging as a trash receptacle. Go ahead and pull this out. This looks like a good spot for now. I'm going to go ahead, open it away from me, up to the side, and towards me. Okay, it's in a good spot for me, so I'm going to go ahead and leave it where it is. And because the rest of this is now my sterile field and I don't want to contaminate anything, I'm going to go ahead and put on my sterile gloves now. So I'm going to come over to the bedside, making sure that the sterile field never leaves my line of vision, because I do not want that to be contaminated in any way. So one more time. Now I'm ready for gloving, keeping my eye on that sterile field all the time. I'm gonna go ahead and toss that to the side because I don't need it anymore. I'm gonna open this up. Being very careful not to get within that 1-inch margin. So in a normal scenario, this table would need to be at least waist height or higher, but because of current resources, this is the highest table that I'm able to access. So this will be considered sterile for this procedure, but in real life it should be higher. All right, so I'm ready to go ahead and glove. Hold it up nice and high. Okay, now being very careful not to let my thumb touch my left hand. Okay, so now I'm gloved. I'm gonna go ahead and knock this off so that I have plenty of workspace if I need it. And I'm gonna go ahead and move back over to the bedside and I can get started with the actual procedure. All right, so I'm gonna start with my drape. I need to open it away from the sterile field. I need to make sure the shiny side goes down. Drop it. Make sure I do not touch the patient with my sterile gloves. And now all of this is sterile, so I'm okay to go ahead and touch any of this if I need to adjust, which I'm going to move that a little bit. And I'm going to go ahead and move this closer. So now for my materials, there's an extra pair of sterile gloves in here. I don't need that. I'm going to reach around my sterile field, get rid of that. I don't need my fenestrated drape, so I'm going to reach around, get rid of that in my trash. Here I have my betadine, which I've already confirmed with the patient that she is not allergic to this, so I can go ahead and use it. So I'm going to open the packaging and go ahead and pour it over my cotton balls that are in this kit. Go around the sterile field and discard. I have my clamps, which I'll be using to help me with cleaning. I have my sterile specimen cup here. I'm going to go ahead and open it and stick it to the side, still within my sterile field. Then I have my lubricant. I'm going to go ahead and open it. I would put a little bit into the kit that I can use to then lubricate the tip of the catheter before inserting it. And I go ahead and throw that away. And now I am prepared to go ahead and start with preparing the patient for catheterization. So at this time, I'm going to go ahead and contaminate my left hand. So as soon as I touch the patient, my left hand is no longer sterile, and all sterile parts of this procedure will have to be done only with my right hand. So I'm going to go ahead and do that. I'm going to anchor my hand in place and use my pointer finger and my thumb to spread the labia. I'm going to use my right hand, grab the clamps, grab a cotton ball that's soaked in betadine. I'm going to go straight down on the far side. I'm going to go around my sterile field and drop. Now I'm going to grab a second cotton ball down the near side, around my sterile field, drop, and a third cotton ball straight down the middle over the meatus, around my sterile field, and drop. And I also don't need the clamps anymore, so I can go ahead and drop those as well. All right, so now I am ready to go ahead and insert the catheter. So I'm going to move this slightly, move my cup over closer because I need that nearby for my specimen collection. I'm going to go ahead and lubricate the tip of my catheter by putting it in that lubricating jelly that I got earlier. Make sure that the other end of the catheter stays inside. And I'm going to hold it about 2 inches from the end of the catheter, and I need to make sure that my fingers on my right hand do not touch the patient. All right, I'm going to go ahead and insert. Tell the patient to take a few deep breaths on the count of 3. 1, 2, 3. I'm going to insert it about 2 inches. At this point I see urine. Now I'm going to insert it 1 to 2 more inches forward, and I'm going to grasp that with my left hand, and I'm going to clamp. So now that it's clamped, there is no more urine flow. I can now hold this over the specimen cup and unclamp while making sure to keep my left hand securely on the end of the catheter to make sure that it doesn't advance any farther into the bladder. At this point, my fingers are unclamped and urine is flowing into the specimen cup. And now that it's full, I'm going to go ahead and re-clamp with my left hand and move this back into the kit, leaving my left hand clamped. I'm going to go ahead and grab my lid, and I can twist that onto my cup. Okay. And I'm going to just leave that here for now, out of the way. And now that I'm able to pay attention to this, I can unclamp my fingers, still maintaining a firm hold with my left hand, and let the bladder empty the rest of the way. Once urine stops flowing, which we'll say it has, I can re-clamp with my left hand, and I can go ahead and pull the catheter out. So on the count of 3, I'm going to pull this out. 1, 2, 3. Straight out. Okay, so we're finished with the catheter. I'm going to go ahead and dispose of this. I'm going to wrap it up. My gloves. And I'm going to go ahead and put these in the trash. All right, and then I'm going to perform hand hygiene and take care of all of my materials that are here and get some clean gloves. So now that my gloves are on, I can go ahead and clean up my materials. So I'm going to take my specimen cup and move it out of the way in a secure location, again where I can keep an eye on it, but I'll take care of it and take it where it needs to be as soon as I finish the procedure. So for now, I'm just going to stick it in a secure location over here. Now I'm also going to place this container in a secure location as well, because it now has urine in it and I will need to measure that before I empty it at the end of the procedure. So I'm going to go ahead and put this in a secure location in a place where I can still see it. And I can go ahead and take all of this. This is all trash, so I can go ahead and get rid of it. Right, so this is just going to go in the trash. Go ahead and take these off. And I can go ahead and prepare for my final pericare. I'm going to go ahead and wash. And I'm going to go ahead and put on my clean gloves. I would collect my materials again for pericare just like I did at the beginning of the procedure. I would need my basin filled with warm water. I would need 3 washcloths, 1 for cleaning, 1 for rinsing, and 1 for drying. And I would need foaming soap. To begin, I would do hand hygiene, put on my clean gloves. I would use my first washcloth. I would get it wet, use soap between each change of locations. I would then spread the labia, clean down the far side, switch locations on the washcloth, more soap, clean down the near side, more switch locations, more soap, and clean straight down the middle. I would then do the same pattern with the rinsing washcloth, far side, near side, straight down the middle without the soap. And I would do this just with water. And then I would use the third washcloth to just pat the area dry afterwards. I would also like to note that with an uncircumcised male patient, I would retract the foreskin at the beginning of the first pericare before inserting the catheter, and I would leave it in the retracted position until the end of pericare after the procedure, and at which time I would then return the foreskin to its natural position. Okay, so now that pericare is finished, I'm going to go ahead and remove my gloves. Here's our trash, so I'm going to get rid of those. Perform hand hygiene one more time. I'm going to go ahead and take care of my patient. All right, Miss Harumi, How are you feeling after doing that? She says that she feels pretty good. All right, is there anything else that I can do for you? She says no. All right, well, I'm gonna go ahead and leave your call light here for you. It's by the side of your bed, so if you need anything, you can let me know. If not, I'll be back to check on you shortly. And then at this time, I would raise the bed rail on this side, lower the bed back to its original height, and lower the bed rails to provide the patient with plenty of safety. I would make sure that she was in the position that she was when I came into the room. I would make sure to take care of all my materials, emptying the urine, taking care of the basin, and taking the specimen cup with me, making sure there's no trash, leave the room in the condition that it was when I got there. And I would go ahead and leave the room and prepare for documentation. All right, Ms. Fermi, I'll be back to check on you shortly. I would then exit the room, close the door, wash my hands on my way out, and now I can go ahead and document my findings. All right, so today's date is March 28th, 2020. It is currently 1400. I just inserted a 14 French 4.7 millimeter straight catheter on Ms. Harumi to collect a sterile urine specimen for a culture and sensitivity as ordered by the provider. The patient responded well to the procedure. She was cooperative and she was compliant with my instructions, and she didn't complain of any pain or discomfort. I collected 50 milliliters of urine in the specimen cup, as well as 100 additional milliliters within the tray, for a total of 150 milliliters or 150 cc's. The urine that I collected was a light yellow color. It was clear with no cloudiness. There didn't appear to be any odor to it, and it looked like it was the proper viscosity for what I would consider normal urine, or what would be considered normal urine. All right, so now my documentation is complete. So that was demonstration of insertion of an in and out catheter for a sterile urine specimen collection. Thank you.